Hello, everybody. Good afternoon, and welcome to our weekly media briefing and public health update. And today, this briefing is led by the county's Chief Administrative Officer, Rich Madalino. Welcome, everyone. Joining him as well is Dr. Nina Ashford, Chief of Public Health Services, Dr. James Bridgers, the Director of the Department of Health and Human Services, Mr. Sean O'Donnell, also from HHS, Deputy Chief of Public Health Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer. And our guest today is Juliana Desiderio. She's a Senior Director of Strategic Industries and Entrepreneurship for the Maryland Department of Commerce. Dr. Brad Marin, Co-Executive Director of the University of Maryland Institute for Health and Computing, will be joining us shortly. And I'm Lorna Virgili, Hispanic Public Information Officer. Mr. Madalino, good afternoon to you.
Good afternoon, Lorna. It's great to see you, and it's great to see everyone. Thank you for joining the call. Unfortunately, the county executive is unable to join us today, so I'll be running point. Happy to take questions. We're going to have Ms. Desiderio speak and Dr. Marin, and then we'll go over some other issues. I wanted to start by letting everyone know the big news that happened this week with the rollout of our pink and lime lines. Ride-On unveiled 2 Ride-On extra bus routes that connect the Shady Grove Metro Station with key businesses in Rockville and Gaithersburg, as well as the universities at Shady Grove. These 2 lines, the pink and lime lines, will provide regular, reliable service for this growing area with runs every 15 minutes on weekdays and 30 minutes on the weekends. So it's exciting news for us because obviously it does connect so many key employers with access to mass transit in an area that has traditionally struggled with transit opportunities. Also this week, we had an event at the council office building with leaders from across the county in support of Maryland Question 1. In November, when you cast your vote in the general election, there'll be 2 ballot questions for every voter in Montgomery County. Question 1, which is a constitutional amendment to guarantee access to abortion and reproductive rights in Maryland. And question A, which would reduce the term limits for the county executive. So the county executive asked me to thank all of his council colleagues, as well as many of his other elected colleagues, for reaffirming the county's commitment to protect reproductive rights. This resolution, again, will be question 1 on the ballot. Remember, come November, vote yes or for question 1, vote against question A. Don't let them take your choice away. And then as we move on this week, the county executive had his first budget forum for the FY26 budget. Fiscal year 26 starts on July 1st of next year. The county council will be reviewing that budget come next April and May. The county executive has to introduce the budget on March 15th of 2025. He's having 11 forums around the county to seek input from residents about what they want out of the FY26 budget. The next 2 forums will be next week. On Monday, it will be at the Wheaton Community Recreation Center, focused on issues in the Mid-County, Bratley, Wheaton to Olney. And then on Wednesday evening, we will be at the Bethesda Chevy Chase High School to look at issues surrounding the Bethesda Chevy Chase Western County issues. So again, Wheaton Rec Center on Monday night, Bethesda Chevy Chase High School on Wednesday night. Please come in and talk about what you're looking for about the county budget, or to learn a little bit about what the county executive is doing when it comes to the fiscal policies of the state of Maryland, of Montgomery County. More information and all of the schedule of the 11 forums can be found on the county website, montgomerycountymd.gov. So with that, we're going to start and turn the conversation into economic development. This week, the county was very happy to host an international life sciences and biotech conference here to demonstrate the county's leadership within this region and within this sector globally. As you can see, the county executive was joined by the governor and hundreds of business leaders from around the region, from around the country, around the world, to talk about life sciences, biotech, and why Montgomery County, Maryland in particular is a great place to have a business and to grow in this field. So that's why we're very excited to have two leaders at the state level to talk to the press a little bit about the exciting things that we're doing within Montgomery County to continue the momentum that we have here in Maryland, in Montgomery County, around the life sciences. So I'm going to first bring in the Director of Strategic Industries and Entrepreneurship, Juliana Desiderio, who's going to talk a little bit about what the state of Maryland is doing to help our strategic industries. And I just want to start by saying, not only is it great to have you join us today, but it was wonderful to have Governor Wes Moore join everyone at the conference to share a little bit about his vision for economic development and to explain to this international crowd why they should be part of Maryland and why they want to be leaders early in about Maryland's decade. As the governor talks about, this is Maryland's decade, and you want to be here to be part of that.
Well, thanks so much for having me. It's a pleasure to be here today and talk up Maryland and life sciences industry. As Governor mentioned, Maryland is a globally recognized life sciences cluster. Together with the BioHealth Capital Region, we are the third largest national life sciences cluster, just behind San Francisco Bay Area and Massachusetts Cambridge. So it's a huge achievement for Maryland. And I will say that Montgomery County is really in the center of the life sciences and biotech industry in Maryland. And we're always so happy to always work with our colleagues in Montgomery County to support not only starting of new companies in Maryland in the life sciences, because we have a lot of very smart people who are thinking about different ideas to support and start companies in this industry, both from our universities and our federal laboratories, then work together to grow these companies and having them expand. For example, we've seen great expansions in most notably in Montgomery County, AstraZeneca is going and growing and doing wonderful things for cancer therapeutics. And then again, as you mentioned, and the governor always talks about, we are also working very hard to talk about Maryland as a place to be for other life sciences companies that are thinking about establishing a presence on the East Coast. So we're always talking about Maryland, Montgomery County in particular, as our greatest concentration of life sciences and biotech. So we always say you're going to be a great company if you think about Maryland, and we have many different programs that stack across, our counties and the state to support the attraction, the growth of this industry. And I'm just really excited that we had this wonderful event at BizNow, and I think another great opportunity for us to highlight all the wonderful things we have that make us a number three in the nation for this cluster. So I'm happy to take any questions about any particular projects or rankings that if you want to have more information about that, but it's exciting times for Maryland.
Thank you very much, Juliana. So it is very exciting times. And one of the reasons why the county executive has been very excited, and one of the reasons why we wanted to have this international conference here now, is the University of Maryland Institute for Health Computing. The county executive has championed this idea from his first moment in office, recognizing that with our University of Maryland partners, the University of Maryland College Park, the University of Maryland Baltimore, which is the home to the medical school, the School of Medicine, as well as the University of Maryland Medical System, which is a healthcare system that operates multiple hospitals around the entire state. You have these three outstanding institutions that are national global leaders in fields of medicine, medical research, biomedical research, and computing, bringing all of that talent, that ability together to unleash the power of both our brains when it comes to biotech and life sciences, as well as computing power to use artificial intelligence, quantum computing in order to solve some of the major life sciences challenges. You know, when we have this wonderful group of public health experts on the phone, on the call today with us, today. And one of the things that we learned through the development of the vaccine for COVID was so much more could be done by the modeling that was done via massive computing power to speed up the processing, the development of vaccines. And, you know, this is the tip of the iceberg when it comes to bringing together medicine, computing, and people in need within the state of Maryland. And that's where the University of Maryland medical system comes into play because they are providing care to hundreds of thousands of people across the state of Maryland. They have an amazing source of information about patients and their needs. And the exciting thing about one of the other developments of linking computing with life sciences is developing drugs that are tailored for each individual. You know, you come up with a vaccine and hope that it works broadly across the public. But if you can develop a vaccine and an intervention, a medicine, a drug that's tailored just for Rich Madaleno, then that is going to help dramatically increase my outcomes, as opposed to just giving me or anyone, I'm using myself as an example of anyone, the same opportunity to have access to a medicine. So just to make those treatments that much more effective and beneficial to each person. So it's a very exciting time. And I know that Dr. Marin isn't with us, but I think over a short period of time, the Institute has grown to more than 70 researchers. We're bringing in more people and trying to then build this connection between these outstanding researchers, this incredible technology, and the fact that here Montgomery County anchors, as Uliana was saying, the third highest concentration of life sciences talent in the country. And let's face it, when you say it in the country, it's really the world. So because we are a global center of excellence in the life sciences, but we're also a leader in so many other areas. And that's why, you know, interesting, Uliana's title, Director of Strategic Industries. Besides just continuing to focus on life sciences, what else are you working on with us in Montgomery County and in Maryland from a strategic industry standpoint?
That's a really great question. And it's exciting because Montgomery County has a little bit of everything, just like Maryland. This is what we're known for. We have a lot of different assets that make it a very exciting and innovative state. So other industries that are always top of mind for the state of Maryland are cybersecurity. And of course, there is emerging technologies that go into computing that you mentioned earlier, which is quantum computing and artificial intelligence and machine learning. And I think that we have a lot of assets across the state that are working on these technologies. And more importantly, we have the final user of these technologies. So companies, federal agencies that will need hospitals, that will need to use these emerging technologies to solve these really complex problems. So cybersecurity, artificial intelligence, quantum is always really exciting. But industries such as manufacturing, you know, classical manufacturing, but also advanced manufacturing techniques, as we have a lot of manufacturers, a lot of innovative and a lot of technology-focused manufacturing across Maryland, always, you know, something we pay attention to. Energy is another big player for Maryland, and there's a lot of conversations about climate goals and different uses of energy, making sure that the grid is stable, but also looking forward to the future of the use of energy for, again, these emerging technologies. Agriculture. We can't talk about Maryland without talking about agriculture. So we're thinking about different things and different ways we support agriculture and producers and farmers out there, and also anything involved with the Chesapeake Bay. So I wouldn't be complete if I hadn't mentioned that all of these industries are supported by our workforce, and we have wonderful workforce, a lot of talented people in Maryland. And that's actually one of our biggest selling points when we're talking about Maryland and who support these industries. You know, Maryland, again, is in the top 5 of the most educated workforce, people with very specific skills for very specific education that are needed to support the development of these technologies. So this is just a snapshot of the things that we're always working on. And again, the county has been a wonderful partner and also has a lot of assets, not only in the private sector, but the university just mentioned, but the federal government presence is very important for all of those companies, and also for anybody who is supporting larger federal strategic priorities for the federal government as well. So Montgomery County is a jewel in the crown.
That's what we'd love to hear. So it's a great place to live, work, and play.
Exactly.
So with that, Lorna, I don't know if you want to throw it out for questions for Uliana.
Yeah, let's go ahead and open it up for questions right now. Members of the media, if you have any questions regarding life sciences and for the Senior Director of Strategic Industries for the Maryland Department of Commerce, please raise your hands and we'll be able to chat with her. Any questions? No questions this afternoon. Okay, I toss it back to you, Rich. Uliana, you might decide to remain on this event, or if you need to step out, please feel free to go. And I guess we will wait for Dr. Marin then. Rich?
All right. Thank you very much, Lorna. Uliana, thank you very much. And thank you for everything that you and your colleagues and certainly the Moore-Miller administration is doing to help the state. You have been wonderful partners. The entire administration has been wonderful partners working with us, and we greatly appreciate the efforts. The governor, the lieutenant governor, of course, a Montgomery County resident and former employee of the Montgomery County government, have a commitment to Montgomery County, and it's great to see how that plays out every day. So thank you.
Thanks so
you to your
much, everybody.
colleagues.
Thank you.
So with that, we'll go on to the health briefing. Good news, fewer cases of COVID-19 in Maryland and in Montgomery County. We're going to hear a little bit about how that's and why that's happening. A week-to-week decrease in the number of people hospitalized with COVID-19. And as always, the COVID-19 vaccination is the best protection from severe disease, hospitalization, and death. We can't say it enough. It's not necessarily going to keep you from getting COVID, but it's certainly going to help make sure if you do get COVID-19, you're going to have a mild case. So with that, I'll turn it over to the HHS team because I know they want to talk about testing, the availability of testing, and the fact that updated vaccines are available. You can get them now. I know my mother-in-law is getting one today as we speak. So I will turn it over to, is it Sean first?
Sure. Happy to follow up. And you're right. Not everyone who gets vaccinated will not get COVID ever again, but it does also reduce the likelihood that you'll be symptomatic. And it certainly does reduce the more severe symptoms when you get an updated shot. The shots that are out now are not technically boosters. It's a new strain that is protecting you against the one that's currently going around. So we do recommend people get that. This year, it's good timing because the flu shots are available at the same time as the COVID shots, and you can get them at the same time. So, that saves people's trips out there. We just recommend it. These are both covered by your insurance, and we recommend you talk to your healthcare provider or your insurer because they may stipulate where you need to go to get the shot to have it covered. But recommend that. Yes, we're seeing the hospitalizations this past week are lower than they were in the previous weeks. It's 10 fewer patients with a COVID diagnosis in the Montgomery County hospitals, which is good news. But it's also back to school time. And when our kids are in that smaller setting and with less robust immune systems, they do tend to catch things and spread them around. So we're just urging caution on that. And there should be some tests that are available through the federal government by mail later this month. They're going to resume that program where you can write in and they'll mail you test kits to your address. So that is good news. And again, if you do need testing, that is something that is covered by your insurance program if you're symptomatic. So we recommend using all those resources available to you. There's also, I just wanted to mention, this is also the season where our seniors will be recommended, if they have not already gotten the RSV shot last year, they'll be recommended to get it this year. Dr. Ashford or Dr. Bridgers, do you have anything you'd like to add?
The only thing that I would add is school has been back in session for a few weeks, but if your kiddos still need vaccinations, please make sure to do that. We do have some remaining vaccination clinics available on our website. So if you have not gotten your kiddos their required vaccines for school, there's still time to do so. Dr. Bridgers.
Sure, thank you. One update that's not health related, but human service related. I want to thank all of our partners who supported and prevented the eviction of 26 families at the Enclave this past week. Working in partnership, rental stabilization is one of the county executive's priority. And so we were able to work with the Maryland Office of Refugee and Asylees, Department of Housing and Community Affairs, and our great services to end and prevent homelessness to not only provide the pay and support of the arrearages, but also the case management and the employment assistant that all of the partners provided. So I want to offer a word of thanks to all of the partners to help minimize the eviction of these 26 families.
Thank you very much to the HHS team. I do see that Dr. Bratley Marin, Co-Executive Director, University of Maryland Institute for Health Computing, has joined us. So welcome. Thank you for joining us. Mr. Madaleno, would you like to introduce him, and then we'll take all questions together?
Sure, Brad, I already had a chance to talk about the IHC, the partnership with the University of Maryland, why it's so important, why the county executive loves this project so much. So if you want to spend a little bit of time talking about how the IHC has grown and actually more focused on where it's going and why it has, as I remember one of your colleagues saying when we announced the partnership, that it has the potential to allow Montgomery County and this part of Maryland to be the Silicon Valley of healthcare.
Yes, thank you very much for the opportunity to be here. I apologize for being late. I'm at the BizNow regional conference, and the session went just a couple minutes over. So I'm very pleased to report our update to you that the Institute for Health Computing workforce now includes about 70 people encompassing a wide variety of professional and graduate degrees, including MD, PhD, MBA, JD, Master's in Science, Master's in Public Health, Master's in Fine Arts, as well as others who are in various stages of training, including all the way into the community level that we're expanding our program for enrichment around. And we'll be able to talk more specifically about that in the forthcoming months. Our project right now, or I should say our workforce, includes 56% of our members identifying as underrepresented in science, which is very important to our mission towards building a balanced pipeline of trainees and accomplished data scientists. And that includes strong representation in our internal leadership group. So it's a feature of our demographic that spans all roles, which we're very proud of. The scientific skill set is quite vast. It includes heavy interest and accomplishment in mathematics, public health, biostatistics, genomics, education, chemistry, biology, artificial intelligence, of course, machine learning, all of the new and most cutting edge analytical methods that we think are critically important for our mission to promote public-private partnerships in the biotech and health science space in Montgomery County, as well as to live up to our central mission of improving the wellness and outcomes for patients across Maryland that spans the life cycle, and as well as all diseases, with a major emphasis on health equity. I can talk a little bit about some of the projects that we're advancing right now, many of which focus on the value of artificial intelligence in drug development, the role of machine learning in improving early diagnostics, and other types of approaches that aim to mitigate the burden of disease that afflicts large segments of our population. But maybe I'll stop there and address any other specific questions, if that's helpful.
Thank you, Brad. I know you're joining from an exciting international conference that we're hosting. I don't think you have the best Wi-Fi right now, so
Sorry.
we hear you well, but sometimes your picture is glitching, which is why I want to make sure everyone who's on this call should realize, you want to figure out a time to meet with Dr. Marin, to go to the IHC, to talk about what's happening, because this is exciting stuff that has the ability to change the health outcomes of so many people, especially what you were talking about with tailored care to people is exciting. And in a diverse community like ours, in a diverse community region like ours and state, this has enormous implications for positive health outcomes for people here and everywhere. So really, it is worth trying to set up a time with Dr. Marin, with his colleagues at IHC, to understand what's happening, because I think your readers, your viewers will want to know and understand what's happening, and will feel great as taxpayers of the state of Maryland that they are participating in this sort of activity.
Absolutely. We're glad to meet with anyone at any time that we think could be helpful, and to explain what we do, and we welcome that.
Yeah.
Thank you, Dr. Marin. Members of the media, would you like to post any questions with Dr. Bratley Marin right now? Taking into account that he is at a conference and the Wi-Fi is not the best at this time.
I'd like to acknowledge that my executive co-director, Adam Porter, who I work with as a foundational partner at the IHC, we're very excited to be together in this project, has just joined. So welcome, Adam.
Thank you. Thank you to both of you and all of your colleagues for the work that's being done in Montgomery County, for working with the county government and your colleagues from around the state to stand this up, because this is an exciting opportunity.
Okay.
And I noticed that WRC Channel 4 is the only broadcast station on, so they don't want to miss this opportunity to go out and actually spend time at the IHC, talk to the researchers there, and get an understanding of what's happening, because your viewers are going to want to know what is on the verge of happening, which will revolutionize healthcare.
Absolutely, 100%. We're more than glad to meet with them.
All right.
Any questions? Members of the media, any questions at this time? Please raise your hands. No
I can't
questions.
believe we're going to get through a briefing without any questions for Earl. This is shocking.
Well, since there are no, there is Mariam Shassad, MCM, Montgomery Community Media. Good afternoon, Mariam.
Good afternoon. Sorry, are these, is this for all questions in general? Sure.
These
Okay.
are life science questions preferred at this time. Do you have more different topics to address? CAO Madaleno? No, you're good. I guess we're open for any questions, Mariam.
Thank you. Sorry if I missed this earlier. I just wanted to confirm, is the county executive at the BizNow conference again today?
He is not today. He was a speaker yesterday. He had another issue he needed to tend to.
Okay, thank you.
Yep.
Any other questions, members of the media? No more questions today? All right, Mr. Madaleno, I toss it to you so that you close us out this afternoon.
All right. Thank you, everyone, for joining us. And
Thank
again, a huge thank you to Dr. Marin, to Dr. Porter for your work. All of your colleagues' work are, thank you very much to Ms. Desiderio for the work of the Maryland Department of Commerce. And thank you all to my colleagues across county government for your work every day trying to keep the public health safe in this community. Lorna, thanks for moderating. And I'm sure next week, everyone will be back for the county executive's return to the media briefing. Have a great and beautiful have a great afternoon on this beautiful day.
Thank you very much.
Thank you. Thank you, everyone.